Hi, I'm Debbie. I've been a hygienist for more than 14 years, and I have a secret for you. I love cleaning teeth. And I have seen a lot of patients over the years that have braces, and they don't love cleaning their teeth. Some of them are young, some of them are old, but they all have a hard time cleaning their teeth when their braces are on. There are 4 areas you need to clean on the outsides alone when you brush your teeth. The first area is above the bracket, cleaning the tooth and the gums. The second area is down into the bracket. The third area is straight onto the bracket. The fourth area is up into the bracket because brackets hide a lot of plaque and bacteria. There are 2 different ways to do this. You can either do 1 or 2 teeth at a time, doing all of the proper angles, above the bracket, down into the bracket, straight on the bracket, up into the bracket, and then move on to the next few teeth. Or you can do the whole arch above the bracket, go back, do the whole arch down into the bracket, and the remaining 2 angles on the bracket, up into the bracket. Don't forget to brush the chewing sides and the insides when you're finished. How long do you think all of this brushing, all these different angles will take? It's going to take you about 4 minutes to do it properly. That's right, it's a long time, but it's worth it to have your teeth nice and clean. And then you only have to do this long 4-minute brush 1 time a day. However, even though you can clean your teeth pretty well with this manual brush, I strongly recommend you use an electric toothbrush while you have your braces on your teeth. The patients I see with the healthiest teeth and the cleanest mouth, they always have an electric toothbrush. Stay tuned for our next video about what I like to think of as the Ortho BFF, which is this little interdental brush. Dental brushes come in different sizes and shapes, so finding the right brush is like finding the right size shoe. It's okay if you need a few pair, 1 to fit the bigger spaces and 1 to fit the smaller spaces. Don't forget, with braces, your teeth will be moving, so the spaces will change sizes too. You start by using the interdental brush and going gently under the wire and moving back and forth. You also want to move to the side to clean the brackets. When you're finished, move on to the next space. If you can, after you finish using your interdental brushes, swish with water. That way you can get all that plaque that you've loosened out of your mouth and off your teeth and gums. You might struggle at first with your friendship with your interdental brush. However, with practice, in no time, you'll be using it, even with your eyes closed. It does get that easy. Patients never believe me when I tell them that, but after a few weeks of practice, sure enough, they can use it easily without even looking in a mirror. However, if you feel uncoordinated when you start using this little brush, just wait until we talk about our next tool, which is the famous floss. Before we talk about the floss, there's someone here with me I'd like you to meet. This is Adam, and Adam has braces. So I need to ask Adam a few questions. Adam, when you used to play outside all day long, and then you'd come in for dinner, what would your mom make you do?
Wash my hands?
That's right. And what if you washed your hands just like this? Would that be good enough for her?
No, because then I'd have heaps of dirt between my fingers.
That's right. And if you brush your teeth without flossing, it's exactly the same. You actually miss 35% of your tooth surface when you don't floss if you brush your teeth. So it's really important, just like washing your hands, to get between your teeth, just like you get between your fingers.
Flossing is so hard. I really don't like it.
Wait, Adam. You thought you were supposed to like flossing? Nobody likes flossing, Adam. Not even I like to floss my teeth. But do you know why I do it? I do it because of all that plaque and bacteria that's between your teeth that you can't get unless you use the dental floss. So you only floss the ones you want to keep. So here are 3 different ways to help you floss your teeth. Now, Adam, do you floss your teeth?
No.
No. Okay. Well, let's talk about different tools and different ways we can do it. The first one is called super floss. This has a stiff end and a spongy part and the regular floss. The stiff end you use to go underneath the wire. Now, for some people, the super floss, this stiff part, gets soggy and soft, and then it's hard to use. But some people really like it, so there's one option. The second option is to use a threader. When you use a threader, you can use any kind of floss you want on the end of it. And this one, this threader, is really flexible and very thin. So it's the best choice if you have really tight spots between your teeth. There's another threader that's actually my favorite, and it's this one. It's stiff and curved, and it fits between the teeth really well. And all you have to do is whichever type of floss you'd like to use, you just tie a knot. Good. And then your floss is attached, and the floss won't come off the threader. Okay? And then you just put the floss right under the threader. You just wrap one side and to the other, and you can also use this to clean along the bracket. Okay? And then you move on to the next tooth. So when you floss, you just put this threader underneath the wire, and then you floss just like normally. So you want to go between the teeth and wrap to one side and to the other. It's important to do either a shoe shine motion or up and down, because you're removing the same plaque you remove with a toothbrush. So it takes a few swipes to get that plaque off your teeth. Does that make sense?
But you don't really expect me to do it. It takes ages.
Actually, I do expect you to do it. And with practice, you can get really fast. For example, I can do anyone's teeth in about 2 minutes.
No way.
Yes way. Challenge accepted. Let me floss your teeth. Adam, are you ready? Here we go. All right. Nice job, Adam. So, are you going to start flossing your teeth?
Yeah.
Remember, you only floss the ones you want to keep. Now, Adam, do you wonder what you can eat with braces? Keep watching so we can talk about what foods you can and can't eat when you have braces on your teeth. One of the questions I'm frequently asked is, what can I eat when I have braces on my teeth? Can I still have pizza or burgers or fast food? And the answer for the most part is yes. However, there are a few things you should avoid. 1, anything really hard like a nut, or 2, anything really chewy like toffee. So here, let me just give you the official do not eat list. No nuts, no popcorn, no caramel, no really crusty bread, and no, watch out for it, bagels. This little bagel might look innocent. It's even got a hole in the middle, but it's quite chewy and can easily push off a bracket or bend a wire. Often, a lot of people don't realize how much force they're using when they're chewing their food. Ouch! So watch out and be careful with what you're eating. Be thoughtful about your food. For example, if you want to eat this apple or a carrot, like Andrew's slicing, just cut it off into small pieces. Then it won't do any damage to your braces, and you can enjoy your carrot or other hard foods. But there's always soft foods is a great choice when you have braces. There's lots of yummy soft foods like pasta.
Yeah, yogurt.
Or potatoes.
Like smoothie.
Or ice cream. Yum. So soft foods are a great choice, especially after you just get your braces on or if your teeth are sore. It's the cleaning of your teeth that's the most important when you have braces. So make sure you clean your teeth after every meal. Or if you can't, at least swish your mouth a few times with water to get as much off your teeth as possible. Also, please, please, please avoid using those sugary and acidic drinks. That's what causes the cavities and makes those white spots on your teeth. I'm talking about things like soda, fruit juice, fruit, dried fruits even worse, and coffee and some teas. So watch out for those acidic beverages. It's also very important to have your teeth cleaned professionally more often while you have your braces on. Every 3 to 4 months is ideal for most patients. Just look at how much stuff you can get on your teeth after a few months without a professional cleaning.
Hey Debbie, how about mouth rinse?
Great, Andrew, thank you. I'm so glad you asked. It is very important to use mouthwash every day. In fact, it should be the last thing you do before you go to sleep at night. Make sure it has fluoride in it and make sure it is alcohol-free. It's important to swish for 1 minute, spit it out, and then go to bed. Don't eat or drink anything afterwards. Then the fluoride can work while you're sleeping. It will make your teeth resistant to cavities. Now today, we covered 4 things. We talked about good toothbrushing, interdental brushes, good floss technique, and what can you eat with braces. So, if you have any other questions about your teeth, please call us here at Smilefocus. We would love to help you with your smile.